Gingivitis is a swelling and discolorization of the gums. There is usually no pain or discomfort associated with gingivitis. It's the mildest form of gum disease, and its effects are reversible. But gingivitis can be the gateway to periodontal disease, a much more serious condition, which can lead to irreversible bone loss and eventually tooth loss. The main cause of both gingivitis and periodontal disease is the accumulation of plaque. Plaque is the sticky film of food and bacteria that forms constantly on your teeth. You must remove all of the plaque each day, or it builds up and mineralizes to become tartar, which is also called calculus. The blue spots here are tartar. It takes professional help to remove tartar. There's no way for you to remove it at home. A toothbrush or floss won't even budge it. If it isn't removed, it starts to get onto the root surfaces. Tartar shows up on this X-ray as small white lumps on the sides of the teeth. Bacteria that cause periodontal disease thrive here. Bacteria like the ones in this slide produce toxins. And in periodontal disease, it's these toxins, combined with your body's reaction to them, that destroys bone around your teeth. Once bone has been lost, it never grows back. When too much bone is lost, there's so little support for the teeth, they get loose and have to be removed. Though most people aren't aware of gingivitis, the warning signs are redness where the gums and tooth meet, swollen gums, bleeding when brushing and flossing, and bad breath. To determine whether or not you have gingivitis, we'll perform a thorough examination. We'll look for any changes in gums' shape, colour and contour, and bleeding in the gums upon probing. Take X-rays to check for bone loss, and use the periodontal probe to measure bone levels around the teeth. The measurement is from the bottom of the pocket, where the gums are attached to the tooth, to the top of the gums. Normal readings range from 1 to 3 millimeters. These are healthy gums. They're tight against the teeth and there aren't any pockets. Now take a look at the difference in a case of gingivitis. Notice how swollen and red these gums are. If we determine that you do have gingivitis, treatment always includes a professional cleaning which removes plaque from teeth, as well as a consistent home care regime and a revisit schedule. Depending on the needs of your treatment plan, we may decide that it's important for you to visit us more frequently for professional cleanings while we treat your gums. In some cases, additional steps are required, which could include using a disclosing solution to determine where the plaque is, a review of the proper use of a manual or electric toothbrush, the use of dental floss to clean between teeth, and using an antibacterial rinse to help kill destructive bacteria. In the past, gingivitis and periodontal disease and tooth loss were considered an inevitable part of the aging process. We now know that it has nothing to do with aging. And if we work together to keep the plaque off your teeth and keep your gums healthy, you can avoid tooth loss and maintain a healthy smile for life.